Good afternoon, everybody. Thank you for joining us. Before I turn to COVID this morning, I want to take a moment to acknowledge the dreadful news from Croydon in South London of a police officer being shot dead. The circumstances of this are obviously subject to investigation, but I wanted to take the opportunity to convey my deepest condolences to all of the officers' loved ones. This is a heartbreaking reminder of the dangers police officers confront every single day on our behalf, and of the enormous debt of gratitude we owe them as a result of that. And especially with the Chief Constable of Police Scotland standing next to me, it is important for me to acknowledge that every day, but particularly in the wake of such upsetting and tragic news. Let me now turn to the statistics for COVID today. I can report that the total number of positive cases yesterday was 558. That represents 9.5% of people newly tested, and the total number of cases is now 26,518. The full breakdown, health board by health board, will be published as usual later, but I can confirm just now that 255 of the cases are in Greater Glasgow and Clyde, 119 in Lothian, excuse me, and 61 in Lanarkshire. The remaining 123 cases are across 9 other health boards. Now, today's figures are impacted, as was the case yesterday and indeed the day before, by a number of university outbreaks, and I'm going to say a bit more about universities and students later on. But notwithstanding this, I also want to stress that no one should think or be under the impression that the COVID threat right now is just a university problem, and that there's therefore no need for the rest of us to be taking this seriously. Transmission of COVID is increasing generally across the country, and let's remember that the increase in cases started before the return of universities. So our numbers right now are impacted by universities, but it doesn't change the fact that this is a risk that all of us need to take seriously and that we should all be following the advice. And just to complete the statistical update, I can confirm that 89 people are in hospital, which is 4 more than yesterday. 11 people are in intensive care, which is 1 more than yesterday. And in the past 24 hours, no deaths have been registered of a patient who first tested positive over the previous 28 days. I want to just insert one note of caution around that. National Records of Scotland, who report these figures to us, suffered a power outage this morning. So it is possible that we will have to modify that figure later on. But based on the information I have just now, no deaths were registered over the past 24 hours. And that means that the total number of deaths under the measurement that we use for our daily figures remains 2,510. Now, that total again reminds us of the impact of this virus, and as usual, I want to pass on my condolences, my very deep condolences to everybody who has lost a loved one. Now, as I said a moment ago, I'm joined today by the Chief Constable and also by the Deputy Chief Medical Officer, Dr. Nicola Steedman. In a few moments, the Chief Constable will talk about the new restrictions that are in place and how they will be enforced, and Dr. Steedman will talk about the importance of people going for flu jabs over the days and weeks ahead. But the main thing I want to do is speak to Scotland students today and to set out why we're asking you to do certain things right now to help contain the spread of COVID. Before I move to that, though, let me just draw your attention to an announcement that was made by the Scottish Government last night. We have added now 4 additional countries to the list of those subject to quarantine restrictions. Those countries are Denmark, Iceland, Slovakia and Curacao. And that means that from tomorrow, people travelling to Scotland from these places must self-isolate for 14 days upon their return to Scotland or their arrival here. And that's another reminder of how quickly levels of this virus in any country can change and are changing right now. So I'll say again, please avoid non-essential overseas travel at the moment and think carefully about unnecessary travel anywhere right now. And that advice applies not just to this moment in time, but also to any plans you might have for the October school break. But let me turn now to the main issue I want to address today. And I want to send a message directly today to university students and indeed to the parents of university students, many of whom I know will be worried about their children right now. I'm not a parent, but I am the devoted auntie of a boy who has just started university and is living away from home for the first time. So I do have some insight into the anxiety that you will be feeling right now. And I suppose it's a general point I want to make. The government is having to make some really tough decisions right now, but none of us are immune from the impact of those decisions, and we understand how difficult they are for people because we have families as well and have an insight into that. But the first thing I want to say is direct to students. I am so sorry, so heart sorry that this time of your lives is being made as tough as it is just now. I really feel for you, but I feel especially for those of you who are starting university for the first time and, of course, living away from home for the first time. This is an exciting time in your lives, but I remember from my own experience, which is not yesterday but still very vivid in my mind, that it's also a time of adjustment and it's also a time of homesickness as well. And that's the case for students every year without COVID, but it is much more difficult given the circumstances you are all facing right now. And I want to also be clear, because I know some of you feel as if you're being blamed for the spread of COVID right now, that that's not the case. You don't deserve to be facing this. Nobody deserves to be facing this right now, and it's not your fault. But, and this is just as important, this won't last forever. And the quicker we get COVID back under control, the sooner you will get to enjoy a more normal student life. So I know how difficult what I'm asking you to do is, but please do what is being asked of you. Because although COVID is nobody's fault, we all have to play our part in tackling it. And there is nobody across the country that is not touched by that. There are many families who haven't seen loved ones in care homes for a considerable period of time. There are families across the country that are not able to spend time with each other right now. Everybody is feeling the effects of this, but we all have to play our part to get through what we are facing. Now, there's been some particular discussion about the advice issued last night from Universities Scotland. So what I want to do briefly today is just try to boil that down to the basics of what it is we are asking students to do. Firstly, if you live in student or shared accommodation, please don't have parties and don't socialise in your accommodation with people who are not in the household group that you are living in. And I know the impact of this on students is a bit harder than it is for everybody else because of your shared living arrangements, but this advice is actually no different to what we're asking of the population as a whole, to stay out of each other's houses. And the reason we're asking that is because we know the virus can spread easily when different households mix together in indoor domestic environments. And the second thing we're asking of students, but let me stress, just for this weekend, is to please stay out of pubs, restaurants and cafes. And the reason for this is that there are, as we know, a number of campus outbreaks across Scotland, so we want to do everything possible to stop them spreading any further. And staying away from hospitality this weekend is one of the ways in which students can help us do that. The incubation period of this virus means that the exposure people will have had in the last few days, if they've been interacting socially, means that we will see campus cases continue to rise in the days to come. But if we take steps now to limit the interaction over the next few days, we can help stem that flow and make sure outbreaks don't spread any further. So that's the reason for that advice this weekend. After this weekend, we'll ask students to follow the same rules as everyone else, and that is try to limit your social interactions in pubs and hospitality, but when you do go, you should be in groups of no more than 6 from a maximum of 2 households. We're also asking students to download the Protect Scotland app. It's not mandatory for anyone, but it is strongly encouraged, and your university is asking you to do that because particularly when you might not know everybody you're meeting just now, it's a good way of alerting people that you've been in contact with if you test positive and they then need to isolate. And people might be interested to know that in the past 2 weeks since the app launched, more than 800 people across Scotland have already been notified through the app and asked to self-isolate. So it really does help us try to break the chains of transmission. And lastly, if you've been asked to self-isolate as a student because you have tested positive or if you're a contact of someone who has, please follow that advice. It is really important. But in all of this, and this is a point I want to stress today, your university has a big responsibility to be looking out for your welfare right now, to be making sure you are okay. I've spoken personally this morning to university principals to stress their responsibilities to you, and I know it is something they take seriously, but I also know it's something that parents will want to be assured of. Student services already have special arrangements in place, including 24-hour helplines, support for food deliveries and additional mental health counsellors for those who might need that support. And I'm grateful to all of those, including the many student volunteers who are helping to provide practical and emotional support in this way. And then there's one final point I want to just address today, but we'll say more about this over the weekend. We're aware that for some students who've been asked to self-isolate, they might be finding that situation so difficult that they want to go back to their family home to complete the period of self-isolation. Now, I'm going to be frank, that's a difficult balancing act, because if you go home after you've been asked to self-isolate, that may have implications for your family, who then may also have to self-isolate if you test positive. But we wanted to let you know today, I wanted to let you know that we are looking at what might be possible there, and it is our aim to issue some further guidance on that over the weekend. But the key point to stress is that help is there for you if you need it just now, so if you need it, please ask for it. And then the very final thing I want to say to students today is thank you. Thank you to all of you. Just like everybody else across the country, you are bearing a burden that I desperately wish you didn't have to be bearing right now. But you are being part, you are playing your collective part in helping us beat COVID back. And for that, you have my thanks and deep appreciation, and also understanding of how difficult this is for you at this time. Now, I focus primarily today on what has been asked of students, and I think it's important that we do focus on that today. But all of us have a role in getting COVID back under control. The regulations for the new household and hospitality restrictions come into force today, and the Chief Constable will say a few words about that shortly. For now, just briefly, let me remind everyone what those restrictions are. With some limited exceptions, none of us should be visiting each other's homes at the moment. Outdoors or in public indoor spaces, we mustn't meet in groups of more than 6 from a maximum of 2 households. Children under 12 are not included in these limits outdoors, so they can play with their friends without limitation as long as they're outdoors. And young people aged 12 to 17 are exempt from the 2 household limit out of doors. So they can meet outdoors in groups of up to 6, but all 6 people don't have to be from just 2 households. From today, all hospitality premises will be required to close by 10 p.m. to try to reduce the amount of time people are spending in licensed premises. And beyond that, we are asking people to limit visits to and social interactions in pubs and restaurants as far as possible. These measures are tough. I know they're tough, but it is important that we act early and decisively against this virus if we are to fulfil the priorities I think all of us share: keeping schools open, getting our NHS back to providing non-COVID services, keeping care homes safe and protecting jobs and livelihoods as much as possible. And the danger with an infectious virus is if you don't act quickly and toughly to start with, it gets out of control, and then you have a much more serious situation on your hands. So can I ask everybody to follow these rules? Download the Protect Scotland app, limit your interactions as much as possible, and finally, remember facts. Face coverings, avoid crowded places, clean hands and hard surfaces, keep a 2-metre distance from other people, and self-isolate and get tested if you have symptoms. I don't underestimate how difficult this is for everybody, and it is more difficult 6 months in than it was even when we were under strict lockdown back earlier in the year. But this is essential if we are to get through this, and if we all pull together and do the right things for ourselves and each other, we will get through it more quickly than we will otherwise. So my deep thanks to everybody for all of the sacrifices that I know you are making, and perhaps particularly today because of the issues that I've been talking about, my special thanks to students at our universities. I'll hand over now to the Chief Constable and then Dr Steedman before we take questions as normal.
Thank you, First Minister. Can I also start this afternoon by expressing on behalf of everyone in policing our deepest sympathies and support to the family of our colleague from the Metropolitan Police who was tragically shot on duty in the early hours of this morning. And also support to our colleagues in the Metropolitan Police and indeed to the people of London. The thoughts of the whole of the policing family are with those who have lost a loved family member, a friend and a close colleague. And again, I would also wish to thank everyone across Scotland for stepping forward over the last 6 months, making changes and sacrifices to combat the spread of coronavirus. Changes and sacrifices necessary to protect each other, protect our families, protect our communities. And the experience over the last 6 months has been that the great majority of people continue to take personal responsibility, do the right thing, because at this moment in time, physical distancing is the single intervention that we can all make to prevent the spread of the virus, and ultimately to save lives. But I also know that guidance and regulations have been changing quickly and often, and at times it can be a challenge to keep up to date. Highly restrictive measures on our lives, freedoms and daily routines are indeed in place. So fundamentally, policing is here to support people from all of Scotland's communities, the diverse nature of Scotland's people and communities, to help everyone do the right thing. As I said, do the right thing to prevent the spread of the virus. I would again underline my admiration and compassion for young people who have responded so well to the pandemic during such an important time of their lives. And as we all know, and as the First Minister has outlined, many young people have recently started or returned to further education, and one of my children being one of them. So I know the demands and the expectations, just as the First Minister has outlined. And I also know that it is an incredibly tough set of circumstances that we're asking the students to face. So we in Police Scotland have been working very closely with universities and colleges who have taken further steps to support students. We have very long-standing and good relationships with tertiary education and often work closely to ensure student welfare and student well-being. And to our students, I would endorse the comments and the support of the First Minister and ask them to engage with the universities and colleges and listen to the advice that is being provided. Now, tonight and over the weekend, pubs and restaurants must now close at 10 p.m. Additional officers will be deployed across Scotland to support colleagues from local authorities and to monitor compliance. I think it's important for me to say that the vast majority of licensees have acted with great responsibility during this very challenging period. I pay credit to them and undertake that policing will continue to support and work with the licensed trade. To support the new rules, officers will continue to use good sense and exercise the discretion that is integral to the office of Constable, working with the citizens we serve to support the implementation of these new rules. And of course, we as police officers and members of police staff and our families are of and from these communities, and we have and share the same anxieties and worries. And as we've seen so tragically today in London, officers and staff continue to put themselves in harm's way to protect their fellow citizens. I am grateful and pay personal and heartfelt tribute to them and their families for their commitment over this period to public service and their dedication to help people. I would say to everyone in Scotland, please work with us, demonstrate personal responsibility and common sense, and play your part in the national effort to prevent this virus spreading. Policing is hugely thankful for the overwhelming levels of support and cooperation we see from our fellow citizens every single day. However, there will always be a minority of people who flagrantly disregard the rules. From the outset of this emergency, on one fundamental issue, the consistent advice has been very clear. Indoor gatherings of people from multiple households can allow the virus to spread and should be avoided. As of now, there is a legal duty on all of us, subject to legitimate exemptions, not to visit other people's houses. And what is absolutely clear, is that house parties and house gatherings are not permitted under any circumstances. There can be no excuse for arranging or attending a house party. You must not organise, host or attend a house party or house gathering. It is against the law. And where officers encounter blatant, willful, persistent breaches, we will act decisively. We will enforce the law. Finally, I've said a number of times that sadly home is not a safe place for everyone. Supporting those at additional risk, when at home or online, remains a significant concern and a key priority for the Police Service of Scotland. I urge anyone with concerns for themselves, their family or their neighbours to contact the police. We are here to help you. The Police Service of Scotland is here to keep everyone safe. Please, let's continue to support each other in our shared purpose. Thank you.
Thanks, Chief Constable. And lastly, Dr. Steedman.
Thank you. Hello, everybody. Although it might feel right now as if coronavirus is the only thing that we ever hear about, I want to tell you a little bit today about a tale of two viruses. Now, you have heard from both myself and the First Minister before about our concerns as winter approaches, and with that, the prospect of the flu virus circulating in the population in addition to COVID. And we've always worried that the combination of both flu and COVID together would be an even more serious one for us all. We now know that in that respect, our concerns are justified. So I want to tell you today about two very recent studies which have helped us to better understand the relationship between flu and COVID. So the first study I want to share with you is not even published yet. I heard about it yesterday. So a huge thank you to Professor Callum Semple, who has allowed me to share the results from the Coronavirus Clinical Information Network with you today. Now, the COSIN network is a fantastic group. It's helped us throughout the pandemic by collecting clinical details and outcomes on patients admitted to hospital for COVID infection in England, Scotland and Wales. And in this latest analysis for the period between February and June of this year, this network has showed that even when you take into account the age of patients, the gender of patients, the other health conditions that they might have, patients who get both flu and COVID infection together have more than twice the length of hospital stay than those who just have COVID and not flu. And even more strikingly, the second study I want to share with you is one by Public Health England, and this was commented on in the British Medical Journal, in fact, just a couple of days ago. Now, Public Health England looked at the clinical outcomes of almost 20,000 people from January to April of this year, who were tested for both flu and COVID. Now, the study was done at the very end of the flu season, January to April, and so for that reason, there were only 58 people who actually were infected with both viruses, flu and COVID, when they were tested. However, in those people with dual infection, the odds of dying were more than twice as high than those who had COVID alone, and almost 6 times as high as those who had neither flu nor coronavirus. So taking those two large studies together, you probably don't need me to tell you that getting flu and COVID together is likely to be extremely serious. And of course, what we also know is that the people who are most likely to get one infection are also potentially the most vulnerable when it comes to the other infection. But it's not all bad news. And you'll remember that I've spoken to you before about the power of knowledge. And this, I think, is another example where we now have more knowledge about the combined effects of flu and COVID, and that gives us more power. And that's more power to protect ourselves as best we can against the dual winter threat of COVID and flu. Now, one of the best ways of protecting those of us who are vulnerable to flu is by vaccination. And as you know, we offer free flu vaccination every year to those people in the population who are most at risk of the effects of the flu virus. Now, in the past, people who were already entitled to the seasonal flu vaccine and who still are those aged 65 and over, those who have an underlying health condition which increases their risk, pregnant women, healthcare workers like myself, young and unpaid carers, children aged 2 to 5 who aren't yet at school, and also primary school children. Now, this year's Scottish adult flu vaccination programme is officially launching on the 1st of October, And this year we're offering it to even more of the population so that we can maximise the protection that's offered to those who are most at risk and to our population as a whole. And a phased approach is being taken to the delivery of this expansion of the flu vaccination programme, but those who will now also be included are frontline social care workers, the household members of anyone who has previously been shielding. Then we will be offering vaccination to those aged 55 to 64, and subject to vaccine supply globally, we will aim to vaccinate 50 to 54-year-olds following that. Now, the best source of information for anyone else who wants to find out a bit more about flu, about whether they might be eligible, about where flu vaccinations are going to be given in their board, is on the NHS Inform website. And there's an interactive checker there where you can put in whether you are eligible or not, and it will also tell you where your particular board is hosting clinics for flu vaccination this year. Now, we have an excellent history of vaccination uptake in Scotland, of which we should be rightly proud, but we can always improve. And if ever there was a time to do that, this is that time. So, as ever, I want to leave you all with a call to action and something positive, an opportunity to take back some control. So please, if you or any of your loved ones are eligible, take up the offer of flu vaccination this year. And I'm speaking to everyone who is eligible, but especially perhaps those of you who haven't bothered in the past, including some of my fellow healthcare workers I know. Now you have even more reasons to do this, to protect yourself, to protect your loved ones, your patients or those that you care for, and to guard against the combined really serious effects of flu and COVID infection together. The tale of these two viruses is not a happy one, but we can do something to change the story. For COVID, we have the facts to protect us for now. We have the Protect Scotland app. And I know that most of us, including myself, are hoping that a vaccine against COVID will be available and that it will be available soon. But in the meantime, please don't forget about the vaccine that we do have right now, which can help protect us from our other winter foe, flu. Heed the call and act by getting vaccinated against flu when you're contacted. And I know that that's what I'll be doing. It's another vital thing we can do to protect ourselves, our NHS, and to save lives.
Thank you, Nicola. We've taken a bit longer than normal with our opening statements today, but there's some really important issues here that we wanted to address properly, so thank you for bearing with us. I'll go now straight to questions. Jamie McIver from BBC Scotland is the first question.
Good afternoon, First Minister. As well as the students who are self-isolating, there will be first-year students in university halls of residence across Scotland who are homesick or unhappy, sometimes desperately unhappy. They're studying subjects where, for now, learning will predominantly be online. They're being told they can't routinely return to their family home. Should students have been encouraged by universities to move to campus in the first place? And separately, the hospitality industry wants the data underpinning the 10 o'clock curfew. What is the scientific basis for it?
Let me briefly try to take both of those points. I indicated in my remarks that we are looking at whether we can give some more guidance about the circumstances in which students might be able to return home. Particularly, that is students who have been asked to self-isolate, but we recognise that there are wider issues there. So I'm not standing here and saying that we will radically change this situation because of the reasons that everybody understands about trying to minimise the spread, but we're very aware of the difficult situations students are in. On the question about should students have been encouraged back to campus, one of the things, and I don't say this to try to invoke any sympathy, these are the decisions that people like me and indeed university principals that have responsibilities to take these decisions are here to take. It's our jobs. But one of the difficulties of the situation we are in just now is a realisation that when you take a decision over here to reduce harm in one way, inevitably you're creating potentially problems in another area. It's just the invidious nature of being faced with a virus. So I think what we've tried to do, and I know the issues are very different, but we tried and have succeeded so far in getting schools back full time rather than blended learning, because we understand the importance of that for children's educational experience, and that means trade-offs elsewhere. You know, we also want to try and get some kind of student experience back for young people and have them with some face-to-face learning, not an entirely online experience. And that's the judgment that has been made. Had we taken a different decision, and it's perfectly legitimate for people to think you should have taken the different decision, but had we done that, I am pretty sure that by now we'd be getting questions about why we were preventing students being on campus, and was that fair, and was that an overreaction? None of these decisions are absolutely black and white, and none of them are easy, and none of them are entirely straightforward with a 100% right and 100% wrong answer. All I can try to do and assure you of is that we're taking these decisions as best as possible and trying to cope with the implications of whatever decisions we take. And welfare of students and young people is at the heart of that, which is why I hosted the call with university principals this morning, just to satisfy myself that they have the welfare of students at heart. And the final thing I would say on that is, this won't last forever for any of us, and it's the one bit of hope we've got to cling on to right now. The pandemic will pass, and for students, this period of having restrictions in place, of not being able to socialise properly, that won't last forever. The quicker collectively we manage to stem this increase in cases, the quicker we hopefully can give you a bit of normality in your student life back again. And so you can have that campus experience, perhaps not 100% normally until we've got a vaccine for this, but with more normality than you have just now. These are difficult messages, they are difficult decisions, but I'm afraid we are having to navigate our way through an unprecedented situation as best we can. On the hospitality, science is really important when you're dealing with a pandemic, and I try to be as guided by the scientific advice as possible. Sometimes that doesn't give you the definitive answers, and the reason I've got the responsibilities I have is because I have to apply judgment and make the decisions there. But sometimes, while science is important, common sense also has to be a driving factor here. We know that two of the key drivers of transmission, and think about this. This virus transmits when people are close together, and in indoor situations in particular, in people's houses and in other environments where people come close together indoors, is in hospitality. So we know if we can reduce those interactions, we reduce transmission of the virus. And a 10 p.m. curfew is one way of trying to reduce the amount of time people are in hospitality. Now, if people in hospitality, and I know how difficult it is, and most have worked really hard. Unfortunately, saying a 10 p.m. curfew makes no sense. That doesn't lead you in a direction of saying, well, we should just be normal in hospitality. Unfortunately, that leads you in a direction of saying we should have greater restrictions. And we're trying to have the most proportionate approach here that we can. And that's why we're reaching some of these decisions. There will always be open to different points of view and different judgments. The country is, and I'm like this when it's other people's decisions I'm commenting on. The country's full of people who think that they would be taking different decisions. We're all in a really difficult position here. The reason I stand up here every day is to try to the best of my ability, with the limited factors we're taking account of here, to explain why we're reaching these decisions. I don't expect everybody to agree with me, but I would hope people will accept that we put a lot of thought and try to take these decisions with as much care as we can. Gordon Cree from STV.
Thank you, First Minister. It's clearly an impossible situation really for everyone involved, but worth saying that the principals of the universities with the two biggest outbreaks, Glasgow and Napier, are declining to answer questions today, despite there being questions for them to answer. But as you are answering questions, can I ask you what mistakes you think have been made, whether it be by universities or government, around the return of students to university generally, and if any consideration has been given or was given, as some are suggesting today, to a mass testing programme for students at the time of their return? And can I ask the Chief Constable, we've seen around the universities issue, but also more widely, the terms law, guidance, guidelines, advice being used almost interchangeably. Given that your job is to uphold the law, do these sort of grey areas and loose language make the job of enforcement more difficult for you?
I'll hand over to Chief Constable who will answer that point in whatever way he sees fit. Let me just, I'll try to be briefer than I was in response to the first question. I sometimes go on for a period of time here because I'm genuinely trying to convey as much understanding as I can around difficult decisions. And I would encourage anybody in a decision-making position right now to be open about their decisions and to take the time to explain the decisions they're taking. But I can only speak for myself, so that's why I stand here and try to do this. And I hope people who've watched these briefings over the last 6 months, and I don't imagine everybody's watched all of them, but many people have watched some of them. I've tried not to be defensive about getting things wrong, because we have got things wrong and we will get things wrong. But I'm equally very conscious of the fact that this situation is so difficult that almost anything you do is going to have unintended consequences that some people will say are examples of mistakes and getting things wrong. But if you do the opposite, the same will be true. So I just think we've got to recognise right now that nothing is going to be perfect here. And whatever we do, we will create issues in some way. And that is the most difficult thing about this situation. And again, what I'm about to say here, some people will interpret as me pointing the finger of blame at students. Nothing could be further from the truth. I've had many kind of difficult periods in the 6 months, but last night, thinking of students away from home and lonely and all the rest of it, that upsets me just as it upsets everybody. But maybe we didn't convey to students strongly enough about the dangers of getting together and having parties. And that's not blaming students, because everybody understands that they want to do that. I think students now, I've heard some that you'll have interviewed and others will interview, who do, I think, now realise that there's a reason for these rules. But we all have a responsibility here. I feel and accept the weight of the responsibility on my shoulders. University principals should too. But all of us as individuals have to accept a share of this responsibility. So I make mistakes in this every single day, and there's a candid thing to say, but I take these decisions with the best intentions, recognising that there's always going to be people who think I should have done the opposite. And maybe they're right, because there are no easy answers to any of this. But I'll stand here day in and day out for as long as it takes and explain the reasoning for my decisions. On mass testing, we are testing students driven by our testing strategy who are symptomatic, so that we get them identified and contact trace. I won't go into all of the lengthy explanations. Some people have heard me in Parliament address this. There is undoubtedly across all of society a bigger role for testing in future as we go further into this. But there is a big danger, and has been from day one in all aspects of this, of us somehow seeing getting a negative test as equivalent to being vaccinated. You could test a student today who tests negative, but that doesn't mean 100% they don't have the virus, so it doesn't let them off the hook of following all of the advice. And so we've got to be very mindful of how we're using testing and how we are explaining what negative tests mean in different circumstances. But these things continue to be under very close review. I'll hand over now to the Chief Constable.
Thanks, First Minister. I think I said in my opening remarks this afternoon that I'm very well aware that there's been an awful lot of regulations being implemented with very short notice, things being changed very, very quickly. And the reason for that is that because this is a worldwide pandemic, this is an extraordinary set of circumstances. So right from the outset, the police commitment was to help with that public health imperative. Now, you're right, Gordon, in saying that our duty is to uphold the law and enforce the law, but actually it's far more than that. That's a key part of policing, fundamental part of policing. But I'm the Chief Constable of the Police Service of Scotland. I'm not the Chief Constable of the Law Enforcement Service of Scotland. And in the Act that established the Police Service of Scotland and the traditions of policing that go back centuries, as you know, our commitment is to support our fellow citizens, is to look after their broader well-being. That's what I'm charged with in law. And part of that will inevitably be enforcement. But during this extraordinary time, where people's freedoms, people's liberties, people's family relationships have been subject to restrictions never seen before. It's right and proper that the police service looks to engage with people, looks to explain what's required of them. And if they stop ultimately but complying with what's asked of them, if they refuse to do what their fellow citizens are doing, if they refuse to do what their neighbours are doing, well, we will take enforcement action. I've been very, very clear this afternoon. House parties, house gatherings, nobody can be under any illusion of the illegality and the threat from that. So those that organise such events, we will be enforcing the law in that regard, because wider society would not accept it, and wider society would expect the police to take action. But our role, our duty, is to support the public to do the right thing, to try as best we can to get through this public health crisis.
Thanks. Chief. Kieran Jenkins from Channel 4.
First Minister, can you confirm you're asking not just students in halls, but all 250,000 students in Scotland not to go out to any hospitality this weekend? And do you support disciplinary action, including expulsion from university if students don't comply?
I'm making a request of all students for this weekend to try to get campus outbreaks under control, to not go to pubs. Now, I don't underplay the significance of that request, but equally I've asked people for 6 months now not to visit their vulnerable relatives in care homes. I'm having to ask people to do really difficult things all of the time. So I'm asking all students for a weekend to not go to pubs, and hopefully that will help us stem these outbreaks. And on the second part of your question, yes, I do support universities taking disciplinary action as a last resort and as a backstop. It's a bit similar to how the Chief Constable has outlined the police approach. I would not expect universities, and I spoke to principals this morning about this, and I know this is not their intention, to use discipline as a first resort. But as with the police, if you have people that are just flagrantly breaching rules, then of course discipline and enforcement has to be a part of the answer. But I am asking everybody across Scotland right now, and in the main people are responding, to do the right things, not because of the threat of enforcement or disciplinary action, but to do the right things for the right reasons, because by all of us doing the right things, we are more successful in stopping an infectious and dangerous virus, making people ill and taking the lives of some people. And that's the spirit I will continue to try to get people to pull together in. Phil McDonald from Global.
Thanks, First Minister. Just turning to household restrictions, I'm just looking for some clarity for parents who share custody of a 17-year-old. One mum's told us that she's not sure what happens when her son turns 18, if he has to choose between staying with her or his dad. Essentially, in the space of a day, he can go from being able to stay with both parents to just one. I know it will affect a limited number of people, but is it simply the case that new 18-year-olds won't be able to stay with one of their parents under these new restrictions?
I'm going to come back to you just with a definitive answer on that, because I want to, on all of these points of detail, I want to make sure I'm getting them right before I give definitive answers. But generally, we've got an exception around shared parenting for the household rules, and also where people, and this will apply to couples that are apart with shared responsibility for parents, there is also the ability to have extended households, because we don't want somebody who is used to going between two parents not to be able to do that. But just I want to be able to just double check what the legal position is there before I absolutely confirm that to you. But generally speaking, where children or young people are used to staying between different parents, we want that to be able to continue. Callum Clark from Bauer.
Good afternoon, First Minister. Just back to the request for students to avoid bars and restaurants this weekend. Radio 10 News has spoken to the student president at Dundee University who warned this will lead to more activities going underground, such as flat parties, house parties. Do you think this measure will cause more harm than good?
Well, look, if I believe that everybody is just determined to breach all and ignore all of the advice, regardless of the health risks, then yes, these unintended consequences are there. But I don't believe that. I believe that most people want to do the right thing, and therefore they're being asked not to go to the pub for a weekend, which, I remember my student days. I'm not saying that is nothing, but lots of people have been asked to do lots of difficult things over the past 6 months, and they're being asked not to have parties indoors. Now, you know, I know that's difficult for students, but that's what we're asking. And if people do act in the way you're saying, and if people, whether students or anybody else, I think the Chief Constable would probably tell you the house parties the police have been dealing with in the last couple of weeks are not all student house parties, far from it. But where people are breaching those rules and having house parties regardless, the police will enforce that, as they should, because people doing that kind of thing are putting lives at risk. Do you want to add a bit about house parties?
Thanks, First Minister. I think that is an important point to make. As I said, understandably, with students starting or returning to university, there's been a large focus on student activity, particularly, I suppose, the freshers and their first arrival there. But it is really, really important to stress that from a policing perspective, we're looking across the whole of the country. I think in general terms, we've been called to around 1,500 reports, no more than that, reports of gatherings or apparent parties. So inevitably, we would attend, we make initial inquiry, every set of circumstances is different, the people are different. But our assessment from the number of calls that we've had to respond to, we've taken action in probably about a quarter of those. But of the times we've gone and taken action, of the times we've taken action, only 10% we would assess would involve students. So actually the gatherings, the house parties that everybody must know are against the law, are actually taking place in communities that are not within the student community. So we're going to continue to work with universities, work with colleges, work with student bodies to try to support them, make sure that they're not putting themselves in harm's way, they're not in circumstances that's likely to cause the virus to spread. And as we've done right from the outset, we'll look to explain the requirements, we'll look to support people to do the right thing. But just if people will continue just to flout, we will enforce the law regardless of the individual's job, role or function.
Katrine Bussey from PA.
Good afternoon, First Minister. This question is probably more one for the Chief Constable, if I may. I was interested, you said you were going to be deploying extra resources on the streets of Scotland tonight as the curfew on pubs and hospitality comes in. Is that because you expect some trouble if people are perhaps unhappy at their social life being curtailed? And you spoke about house parties just there. Is there a risk that by curtailing the amount of time people can spend in pubs, they'll maybe just go in and take their drinking on and carry it on in somebody else's house? And again, we've heard about the kind of abuse that your officers have had to contend with when breaking up parties. Is that still a problem that police officers across Scotland are seeing on a regular basis?
Thanks, Katrine. Your middle question, I think there was three parts there. Your middle question around is there a danger that people, if you like, finish drinking in the pub a little bit earlier and then are tempted to go back to a house party? Yes, is the answer. There is a danger. I think, as the First Minister said, this is a matter of balancing a lot of potential scenarios to try and strike the right balance. That's why I've been so clear this afternoon about discouraging people from having house parties, discouraging people from gathering together indoors where there's no level of regulation or oversight. And the reason that we're going to ask our officers to be around at the 10 o'clock curfew tonight is because it's a change. And in any period of adjustment, as we've seen, the vast majority of licensees and pubs and the vast majority of customers will do the right thing, but there will always be some that won't. Some may be unaware, I would be very surprised, but we'll find out. We'll go and speak to people and encourage them to do the right thing, and if they're not, ultimately, we'll take enforcement action. But our experience thus far, as I said again in my opening remarks, over the 6 months that we've had, with a few pretty high-profile notable exceptions, the vast majority of people who run pubs, restaurants and other parts of hospitality have been tremendously professional and committed to doing the right thing. We'll continue to support them to do that, and those that don't, we'll take action against them. In terms of abuse on officers and staff, it's utterly disgraceful, and again I would ask for the support of all the public in that regard. It's support that we have seen. It's not part of being a police officer or a member of police staff to expect that, whether that's physical or whether it's working 24/7 in a control room, trying to resolve people's issues, trying to direct them to the right place for that level of support. It won't be tolerated. I've made a public pledge of my fundamental commitment to that, and will continue to take action against those who look to do harm to people who are ultimately doing their job for the public.
I echo that 100%. Before I move on, I'm just going to ask Dr. Steedman, maybe as a clinical voice, just to say a few words about why these restrictions matter in the attempt to control the virus.
Absolutely, and from the clinical point of view, the reason that we have put restrictions on hospitality and on household gatherings in particular are because that is where we are seeing the vast majority of transmission taking place in Scotland. And we know that at least 40% of our cases are probably in association with hospitality settings and a further 20% in association with household settings. So what we are trying to do here is to guide people, to give people the right information to allow them to know where their greatest risk is and then to act accordingly. We trust people to feel that sense of personal responsibility, but also that sense of responsibility to their loved ones, to their other members of the family, their friends. And so by giving them the information, we hope that they will help us to make the right choices here. And I suppose clinically, I'll finish with one point, which is that no one should think that they are immune to this infection, and no one should think that just because they are not elderly or don't have other medical conditions, that this is not a serious risk for them. There are young people, albeit in smaller numbers, but there are young people without any other conditions who are dying from this infection. So this is serious, and we are giving people the information to keep them safe. We don't do any of this with any joy, and we abide by these things ourselves. We are all in the same boat. But there are good clinical reasons for recommending what it is that we're recommending at present.
Conor Matchett from the Scotsman.
Thank you, First Minister. A quick question to start with. You said earlier in the week that you wanted to do more with pubs, or thought you could do more with pubs and restaurants. After yesterday's announcement from the Chancellor, I was wondering, now you know what the future is going to be for job support, whether or not you will shut pubs. And on the point of students, we know that universities would have faced a very large financial black hole if students hadn't returned to student accommodation. And we presumably, they told you that that would be the case. Were you pressured at all by universities to rush back the return of students due to the financial implications of students being away from campus?
No, none of my decision making around any of this is impacted by that kind of pressure. We're trying to take difficult, balanced decisions. We're trying to create this balance, which we don't always get right, and we won't always get right, between having as much normality as possible for people while still keeping the virus under control, and that is the factor that is behind these decisions. On the financial side of it, I welcome the Chancellor's announcements as far as they went yesterday. I don't think they went far enough, and I think there is still a need to do more for businesses across the economy generally, but hospitality and tourism perhaps in particular, and therefore we'll be seeking to continue those discussions, hopefully constructively, in the weeks to come. Chris Musson from The Sun.
Hi, First Minister. Just two things quickly. First of all, a simple question to both you and the Chief Constable. Would you expect police to issue fines to students visiting their parents at their family home and that includes students at the Scottish Policing College, who I understand typically go home at weekends. And secondly, just about your response to Gordon Cree on whether we should be mass testing university students. This defence that testing is not the be-all and end-all, that was the same defence you used in April for not introducing mandatory testing for hospital patients being transferred to care homes. So is this not just a phony defence to distract from the fact that you failed to get the necessary systems in place? Because in the case of care homes, you later did introduce testing, of course.
It's not a defence, it's an attempt at an explanation, which is what I try to do every day. I'm genuinely trying not to be defensive about any aspect of this. I think anybody applying any common sense would know that while, yes, the limitations as well as opportunities of testing are the same regardless of what population you're talking about, it is absolutely not the same to be talking about vulnerable elder people going from hospital to care homes and talking about students in a campus situation that will be going and mixing with lots of people. These are two fundamentally different things. We have moved more in the direction of routine testing for certain hospital patients and clinicians, and also, of course, routine testing for staff who work in care homes. That's because of the vulnerability of these patients and the need to keep the infection out of care homes, because we know from bitter experience how quickly it spreads when it gets in. That's a very different thing to saying to a student population, we're going to test you all, and if you test negative, or being in danger of giving the message that if you test negative, you can just live your life normally and go to the pub and socialise normally. So these are not exactly the same things, even although the scientific limitations of testing are applicable across the piece. I'll hand over to Chief Constable on the second point. It's not for me to say when the police should issue fines. What I would say in general, though, is, and the Chief Constable has said this previously and again today, the law is the law and it applies to everybody. But whether it's a student visiting their family home or anybody else in any other circumstance, it will not be the first instinct of the police to enforce and issue a fine. They will look at the circumstances, they'll encourage, they'll educate people about things, and will use enforcement only proportionately. And that, I would imagine, although I'll let the Chief Constable speak, will involve taking account of the circumstances that any officer finds in any particular setting.
Thanks, First Minister. In terms of issuing a fine, Chris, as you know, we have utilised the requirements of the various public health regulations over the last 6 months over 75,000 times. 75,000 times. Now, that can be given advice for people to disperse in private or in public, asking people and at times forcing people to go home, and then at other times taking some formal enforcement action, either through issuing a fixed penalty, a fine, as you say, or if need be, arresting them. And of that, that's under 4,000. So 75,000 times the police in Scotland have had to go and look at a situation that fitted the parameters of the public health regulations and requirements. But actually, formal enforcement action has been taken less than 4,000. And the reason for that is because these are extraordinary restrictions. And we want to go, as we've said from the outset, to explain them, to encourage people to do the right thing. And if they don't do that, we will issue a fine. So the same scenario will play in terms of any prima facie breach that we're asked to deal with. We'll firstly encourage people to rectify their behaviour. And if they accept that, and if they do that, then we won't issue a fixed penalty ticket. That's been stated. I've stood here on a number of times and said that, and I've also said, right from late March, that we would expect police officers and members of the public to demonstrate common sense and fundamentally to do the right thing. And that's been the experience thus far. So the starting point won't be a fine. The starting point will be to explain the regulations, what's behind them, and encourage people to do the right thing. In terms of the issue on Tullyallen, that's a place of work. You would not expect me as a Chief Constable to say that we can't continue to maintain police officer strength and police officer capability at a time of national emergency. The police service loses around about 1,000 officers every year through natural retirement primarily, and therefore it's imperative, and has been from the outset, for us to continue to retain the level of police officer strength that we've got, so we can be on the street, so we can be in our community, so we can be taking steps in the online environment to protect people who are vulnerable. So it's been an imperative for people to continue to be at their place of work as they go through their training, so that we can continue to keep the capability that we've got to meet the challenges and threats right in front of us. But as you know, with Brexit, with the climate conference coming to Glasgow next year, there are enormous challenges for policing ahead of us. So it was an imperative for us to continue to have officers coming to their place of work with physical distancing in place, so that they can then turn, go and continue to protect their communities.
Can I just, I'm conscious of time and we've got a lot of questions to get through, and I'm being my usual verbose self today, but there was a point I wanted to make, just going back to students, and Chris's question is an opportunity to make it. I hope my sympathy and empathy for students is obvious today, but equally I want to be clear, we're not singling students out here. There's lots of young people of the same age as university students who'll be living away from home right now working. You know, they might be doing 12-hour shifts in a supermarket or 12-hour shifts in the front line of the health service, and they can't, under the general rules that apply to all of us, they can't go home and visit their parents at the moment if they're living away from home. So we're not singling students out here. This is a general law that is about trying to reduce household transmission of this virus. And I think that's important for people to understand and be clear about. Alistair Grant from the Herald.
Hi there, First Minister. Thanks very much. Many people have criticised the statement from University of Scotland last night, saying it was unclear and caused unnecessary confusion, such as over whether the pub advice applied to this weekend only. James Chalmers, a professor of law at Glasgow University, is among those who have criticised this lack of clarity. He said it's not good enough when you're threatening people with getting chucked out of university. Do you accept the statement caused confusion? And do you regret this? And can I also just double check really quickly, does the ban on socialising and the request not to go to pubs extend to mature students? And what is the advice for those many students who work in bars and restaurants over this weekend?
The request for students not to go to pubs this weekend for one weekend, yes, applies to all students. Now, I'm asking people to do all sorts of difficult things in all sorts of difficult ways. I don't underestimate this, but equally, I'm not sure it is the most difficult thing I've asked people to do, is for one weekend not to go to the pub. So let's keep it in perspective while also being sympathetic to the implications for students. I think there are other things that we're asking students to do that are probably more of a concern, but they're being done for good reasons because of that. It's already been made clear, people who have to go to work, and we recognise that. We're trying to strike the right balance here, but take account of people's practical necessities as we do. And on the statement issued, I'm a politician. A lot of what I do right now, I spend my days taking lots of decisions and everything, but a key part in the middle of the day that I do every day right now is try to communicate the decisions we take and try to do that as clearly as possible. Sometimes we get that right, sometimes we don't get it right, and that will be true of everybody, and you will always look back in a press statement or a speech I've given and think maybe I could have expressed that better and more clearly. So none of us are perfect here. As it happens, I went on Twitter last night and just made sure that a particular point wasn't being misinterpreted, because it looked to me as if it might be. But then I went back and I looked at the statement and the University of Scotland put out, and it actually didn't seem that unclear to me. It said, this weekend, students have been asked not to go to pubs. So, okay, I accept we all have a duty, and it's a duty I take very seriously, to communicate things really clearly. And if with the best will in the world, it turns out maybe that wasn't as clear as it could have been, yes, of course, we will try to learn these lessons. And as I say, one of the reasons I stand here every day is to take every opportunity just to be as clear as possible, because I understand this is difficult for people, and the rules and the regulations are difficult for people to understand. So I always apologise if things are not explained as clearly as they might be, or if we get things wrong, and I'm going to continue to do that, because more important than anything right now is that we don't get stuck in a not being prepared to admit that we might have got things wrong, because then we'll never be able to put them right in future. Mark McLaughlin from The Times.
Afternoon, First Minister. Earlier on during the briefing, you said there's a bigger role for testing in the future. Can I ask what that role is, how far in the future, and why not now? And can I also ask as well, you also repeated what Richard Lockhead said this morning, that if we do routine testing of students and students get a negative test, that they will take it as a license to go about their lives as normal. Can you just confirm, is the reason that you're not mass testing students because you don't have the tests, or because you do have the tests and you just don't trust them to take the test?
It's actually neither of these things. I sometimes I would really love to, be able to simplify things down to headlines, but actually all of these decisions are a lot more complex and a lot more nuanced than this. I know it's the job of journalists to scrutinise and ask these questions in a very direct way, but try to understand that it is very rarely absolutely one thing or the other. It's not that we don't trust students. It is a feature of the PCR test for this virus and the incubation of the virus. Nicola, I'll ask Nicola to say a bit more about this, that you can't be sure that when you get a negative test that you are actually negative for the virus. So we have to say to people, don't rely wholly on tests. Make sure you're taking all of these other precautions. Yes, we don't have an infinite testing capacity. We have built that up substantially and we continue to do that. And as we do that, it enables other decisions to be taken about testing. But even then, there are certain things you might not do because clinically, the advice would be that is not an appropriate use of testing and it may help to give false assurance. So these are very rarely black and white decisions. They are often very nuanced and we have to balance different things. And in terms of the first part of your question, what will be the greater use and when? We take clinical advice on this all the time, and we published an updated testing strategy a number of weeks ago. We will continue to keep all of these things under review. The purposes of greater testing, given that we are testing symptomatic people, we want to test more of the contacts of symptomatic people, and of course beyond that, surveillance is one of the key things of testing beyond symptomatic, as well as protecting vulnerable people, which is why we test care home workers. Nicola, do you want to say a bit more expertly than I can the limitations of the test?
Not expertly at all, but just to say that no test is perfect, and we've never made a secret of that. That's true with any medical test. And when we say that testing is not the silver bullet, it means not that testing is not useful, but that it is more useful in certain circumstances than others. And it is only one of the things that we use in our efforts against COVID. One of the principles that we have in medicine is first do no harm. And therefore, when we do something to anyone, we have to think very carefully about what the balance of benefits and harms will be. We know very clearly that when someone has symptoms, that they are more likely to have COVID, and therefore doing a test is a balance to make that diagnosis, to be able to look after them better, to treat them better. When we do it in people whom we might not otherwise have a reason to think that they have COVID, firstly, it's not a particularly pleasant test to have done, and secondly, it may not give us an accurate result. And one of those things that it can do is it can actually give false positive tests. This will probably open up another can of worms, I'm sure, but in the spirit of being honest, that would mean that people would potentially be asked to isolate and undergo lifestyle restrictions for a period of 14 days or 10 days when they perhaps didn't actually need to. And so that is potentially doing someone harm. And so testing is not the answer everywhere. If we were to just mass test students, would we test them every day? Would we test them twice a day? What would we tell them to do while they were waiting for their results to come back? And the answer is we would tell them to do exactly what we're telling them to do now, which is to use the face coverings, avoid people, all the cleanliness advice that we're giving. So it wouldn't change what we're doing. So testing is a useful tool. It's not perfect. It's not the answer in every single situation. But in this particular case, it's not being rationed because of capacity issues. There will be a greater role for testing as testing develops and testing technology continues to develop. So in the future, if we have even more accurate tests, if we have tests that are extremely rapid and that don't involve taking invasive swabs from people, then we may well be able to use them much more widely, and I hope that we can.
So, as I said, these issues are often more nuanced than just the absolute black and white. I know it doesn't fit on in a headline as easily, but it is a franker answer to give. Tom Martin from the Daily Express.
Hi, thank you, First Minister. Could I just return to this issue of students being encouraged to return to campuses when most of it's being done online? A lot of these people are forking out hundreds and hundreds of pounds for accommodation when, in their view, it might not now seem necessary. As they'll be feeling a bit misled, perhaps even cheated. Do you think they should be entitled to refunds, and likewise those from other parts of the UK and other parts of the world who paid fees? Should they be getting refunds as well, and who should foot the bill?
Universities communicate with their students and will have communicated with their students about how their courses were going to be done. I think that's probably an issue better for university principals to address. What I'm saying is that these are not the issues that guide government decision making or judgments here. We're trying to strike the best balance between as much normality and keeping the virus under control. And the only thing that is absolutely certain right now, and I should say, I don't mean this as a criticism of journalists doing their job, I absolutely don't, but had we decided not to have any students back on campus this year, I'd probably be standing here getting pressure to explain that, and it would be getting put to me that was a massive overreaction and we were denying students any kind of student experience. So, and it is legitimate to decide that we should have done that rather than what has been done. I'm not saying otherwise. These, as I said before, there's no 100% right, 100% wrong decisions right now. We're trying to get them as right as we possibly can. Do you want to say? Mm-hmm.
Just going to add that there are benefits to many people from face-to-face learning. Some people learn better in a face-to-face situation than online. And I think as someone who remembers their university time very well and who lived away from home, there are other elements to student life as well as the parties. There's the independence that comes from living away from home, that growing up and looking after yourself and becoming a fully fledged independent adult. And so these are the balances that we're trying to do our best with when decisions are made about not moving everything to just online. University is not just about lectures. It's not just about absorbing information like a sponge. It's about becoming an adult, and that is very important clinically for development. So these are the kinds of balances we're trying very hard to make.
Rachel Watson from the Daily Mail.
Thanks, First Minister. I just wanted to go back to the advice for students to stay away from pubs and restaurants this weekend. What is the evidence that a 3-day break will help with anything? And also, does this mean that students can't meet their parents for a coffee or dinner, for example? And could you just clarify on whether this also means students can't go to work if they work in a bar? I didn't pick up if you answered that before.
I think University of Scotland answered it last night, or our university, and I've, I think, answered it a couple of times already today. No, we're not stopping students going to work. We recognise that people have to go to work, they have to go to work. This is about socialising. And the evidence, look, we're trying to make some common sense judgments here. If we have outbreaks among student populations, then what are the things we can do? We know that the outbreaks we're seeing right now will have started in exposures that students have had in previous days. And I would expect to see the numbers of student cases continue to rise over the next week or so, because many of those infections will already have happened but will have yet to be identified. But what we need to do now is try to stem that by reducing the chances of students who might have the virus but they haven't been tested yet because they don't have symptoms, they might not know, passing that on further and going into settings where they might be taking it outside the student population. So it's kind of common sense that one way of doing that over the next few days is to stay out of pubs and restaurants. And that means stay out of pubs and restaurants, whether it's meeting your pals or meeting anybody else for lunch or coffee. And I keep coming back to this. I'm not saying this is an insignificant thing to ask people to do. Any restriction that any politician stands and asks people to make in their own life is a big thing to do. But asking people to stay out of pubs for one weekend in the grand scheme of all of the difficult things that people have had to do over the past 6 months, maybe isn't the the absolute worst one we've had to do. My email inbox right now is full of people who are understandably, pleading about being able to go into care homes to see elderly relatives that they haven't seen for 6 months in the flesh. People who haven't been able to visit older people in hospital. Everybody's been asked to do, people who haven't seen their families in person for a long time. This is horrendous for so many people right now. And for people being asked to stay out the pub for a weekend, I'm not saying it's nothing, but let's see it in the overall context of this. And if it stops this virus spreading beyond campuses, maybe it's just a price that is worth paying. Nicola.
There is also a clinical reason for this, just to point that out. Although we know that people are infectious for about 10 days after symptoms appear, we also know that they are almost most likely to transmit just around the time when their symptoms are appearing and for potentially 1 or 2 days before they actually get symptoms. So in answer to your question, will it make a difference 2 or 3 days if people don't go to crowded environments? In a population where we know through no blame and no fault they are potentially at higher risk, then yes, it could well do, because it might well just remove those people who are not yet symptomatic who could be transmitting the virus.
Right, I've got 3 questions left, and we're taking an awful long time today. My apologies. Libby Brooks from The Guardian.
Thanks, First Minister. University Scotland has confirmed that no student representatives were involved in the drafting of the guidelines from yesterday. And Louise MacDonald of Young Scot has called for students to be an equal partner in any future rulemaking. And I just wanted to ask if you can reassure students that they will be involved in future discussions on regulations of this kind, and especially if you can reassure them that student mental health services won't be overwhelmed. Thanks.
Yes, I do think it's really important that students are involved in these decisions. We are all having to take decisions quite rapidly just now, and I would ask people to be understanding of that. But just as if we're taking decisions about workplace regulation, we want trade unions involved. If decisions are being taken about student life and restrictions that apply there, student organisations should be involved as well. That includes the NUS, obviously, but includes student representative bodies on campuses. And I'm sure universities do understand the importance of that, and I would encourage that to happen. And on mental health services, it was one of the issues I touched on with university principals. Of course, we need to make sure that welfare and mental health support is there for students, and I know it's something that principals are very seized of in terms of the importance of that. Derek Healy from the Courier.
Thank you, First Minister. I just wanted to pick back up on Alistair's question. We saw Jason Leach on Twitter yesterday roll back on his comments from the night before about students returning to their family home. And then last night, again on Twitter, you had to clarify that University of Scotland and the Scottish Government statement. That really stated all students would be required to download the Protect Scotland app. But in this briefing, you've just said that isn't mandatory. So just to be clear, do you think the communication on this issue has been good enough? And what kind of impact do you think that shifting messaging is having on students who might be struggling with all this?
If people think that any communication wasn't clear enough, we've got to take that on board. And I know we all will take that on board. But, I stand here for, now almost an hour and a half every day so that I can try to be clear in communications. I can, address or correct any miscommunication. We're all trying our best here right now. And the reference to Jason, of everybody, there's probably nobody, even me, who's done more to try to communicate these messages more than Jason has over the past 6 months. And occasionally even he will just get it slightly wrong inadvertently, and we'll correct that. We are all human and we're all trying our best right now, but sometimes we won't get it 100% right. And all I'd say to people is, I said the other day, let's try to be kind to each other and understand the pressures that everybody is living under right now. And that means there will be things that we get wrong, and maybe just cut even politicians and people advising politicians, maybe just even occasionally cut us a bit of slack as well, even university principals. And we try to get it as right as possible. And if things haven't been perfect, we'll try to get them better in future. And last question today, Daniel Sanderson from The Telegraph.
Thank you very much, First Minister. If a normal member of the public breaks the COVID rules, for example, by going to a party, they would as I understand it, in the first instance, be asked nicely to go home. If they refuse, they could get a £60 fine. If they do that again, they would get a £120 fine. Now, under the rules that were backed by the government for students, the yellow card, red card approach, students are being told that if they did that, they would face being kicked out of university, which obviously could have an absolutely devastating impact on the rest of their lives. So if we're really all in this together, as you said earlier this week, how can you justify having such different approaches in terms of punishments for two different sections of society?
I don't think it is different. Enforcement by the police will be used as a last resort, and police action, if students, applies to students as well as the rest of the population. It is the law that applies. But in terms of university discipline, it's a last resort. No university wants to be disciplining students, and I've had that conversation as well with the principals this morning. It's there as a last resort for students who just don't abide by the rules. And I suppose I'd flip it on its head. We should all be doing the right things right now, not because we want to do it or because we're particularly happy at having these restrictions on our lives, but because we know the consequences of not doing them is that this virus spreads and we end up in a much worse position. So instead of us thinking about what happens to the people who don't, let's all encourage each other to do the right things for the right reasons, which is always ultimately our best defence against this. That concludes the questions today. I know we've taken up more of your time than normal today, so for those of you who have stuck with us throughout the entire briefing, thank you very much. Thank you to the Chief Constable, as always, not just for joining me here at these updates, but also through him to every police officer across the country and support staff who are working so hard to help in this effort. And I'm not just saying this because I'm standing next to the Chief Constable. I mean it. I think the way in which Police Scotland have approached this and the way you've heard the Chief Constable outline with enforcement as a last resort is exemplary. And I am deeply grateful to all of the officers across the country who are doing that. Please respect them in the job that they are doing, because they are trying to keep us safe just as we're all trying to keep each other safe. Thank you to Dr. Steedman. The clinicians who advise the government are doing a sterling job as well. The science and the clinical advice is vitally important, but ultimately, we have to take decisions based on judgment and common sense as well, and that's what we're trying to do. A thanks to Rachel, as always, for making this briefing accessible, and thank you to all of you. I'm very aware that this has probably been, for everybody, one of the toughest weeks so far in the whole pandemic, because it's marked the 6 months since lockdown, but it's also marked a moment when we're going into winter, cases are on the rise again, and it feels as if we've had to take a step backwards. And I feel that frustration and sense of disappointment and upset as well. But this was never going to be a straightforward path through a global pandemic. We just all have to keep doing the right things and pulling together and remembering that our actions right now don't just affect ourselves, they affect everybody. It's not easy right now for anybody. Over the past 6 months, there have been times like today when we've been focusing on students. There have been previous times when it's been the situation in care homes. I remember a period in the summer where the focus was all on whether schools were going to come back or not. And the point I'm making here is that there is no section of society exempt from bearing the burden of this. So it feels really tough for students right now, I get that. And we don't want to make it any tougher than it needs to be. But everybody's finding this tough right now. And ultimately, we have to go through this. I can't wave a magic wand and get rid of COVID. But we'll get through it better, I think, if we try to be kind to each other and help each other and look out for each other and do all of the things that we're being asked to do. Not because the police might fine us if we don't, but because actually it's about keeping each other safe and getting us through this collectively. So thank you for bearing with us today. Thank you to the journalists for putting up with my occasional impatience and my answers to the questions today. This is not easy for any of us, but we will get through it. I promise you it will not last forever. So have as good a weekend as you can. Please, including students, obey all of the advice that you have been given for the sake of yourselves and each other. I'll be back here on Monday, hopefully for not quite as lengthy a session, but we'll start at 12:15 as usual. Thank you very much.